every one of us have received a lot of commentary about this from our constituents. In our own office, just on this issue, we have received 56,000 just in the last few weeks that were calls or emails or letters. And I happen to think that this is good. It's bringing out passions. It's bringing out, unfortunately, sometimes hot passions. Now, there's no place for that. But that indicates some of the hot passions that have brought this out. But just remember, good debate. Remember what President Lincoln said. He said, quote, "With public sentiment, nothing can fail." He says, without it, nothing can succeed. And he was specifically talking about the way we do government and the way we make law in this country. And recall also what President Kennedy said, and that was about 50 years ago. And he said specifically about health care, he said, quote, "The consent of the citizens of this country is essential if this or any other piece of progressive legislation is going to be passed." End of quote, and he was specifically talking about health care. So, Mr. President, every one of us senators can say from the personal meetings, the calls, the letters, the emails, we can tell you that there are a lot of folks out there that do not have access to affordable health care or, in many cases, to quality health care. And we can tell you the stories that we've heard about people being systematically excluded by some of the nation's major managed care insurance companies and/or just insurance companies. And unfortunately, those are not rare cases. But that's why we're here, to do something about it. Now, regardless of where you stand on the specific of the issue, I think that we can agree that the current system, if continued, would be unfair, too costly, and as a result, it needs to be fixed. And it affects every one of us. It's also a truth that sooner or later, every American, 9 out of 10 times, 9 out of 10 of us are going to end up in the hospital at some point. So what do we do? All right, I think the President laid down a good marker. His speech before the joint session was excellent. It gave some clear answers about his views on reform. It's true, he's been more hands-off. Let it be done by the Senate and the House. But interestingly, when he got more specific, as he did in his speech to the joint session, he described or tracked pretty close to what's coming out in Senator Baucus's mark that the Finance Committee is going to take up next week. This legislation is going to let folks that are happy with their insurance keep it, including our senior citizens who are on Medicare and our veterans who have their health care. But it's also going to create a marketplace called the Health Insurance Exchange for those who don't have insurance. It's going to hold the insurance companies' feet to the fire to require them to cover everyone and prevent them from dropping people when they get sick. It's going to contain several additional measures aimed at reducing overall medical and prescription drug costs. And it's going to go right at the waste and the fraud in the system. Now, this is a starting point, Mr. President. This isn't the end-all and be-all. This is a starting point. Now, there are some concerns that I want to share with the Senate. Those who are on Medicare, who generally are very favorable for their Medicare coverage. It's certainly a concern of this senator, who has a substantial population in my state of Florida of senior citizens on Medicare, that they not have something taken away from them that they have come to expect and to rely on in Medicare. And that particularly is so with regard to a program called Medicare Advantage, which is a fancy term for a Medicare HMO, a health maintenance organization. I think it would be intolerable to ask the senior citizens on Medicare who have it to give up substantial health benefits that they're enjoying under Medicare. For hundreds of thousands of seniors who didn't conceive of Medicare Advantage, but who have come to rely on it, this senator is going to offer an amendment that will shield them from those benefit cuts on existing senior citizens on Medicare. I don't think that we can punish senior citizens who signed up. And if the changes need to be made for the future solvency of Medicare, then the senior citizens currently with Medicare Advantage should be grandfathered in. And that's what my amendment's going to be. It's going to say that on the date of the bill, once it's signed into law, that those who have that benefit should not have it taken away. Another amendment would require the pharmaceutical companies to provide rebates to Medicare, just like they've been doing for years, for decades, to Medicaid. And by the way, it would save Medicare a ton of money. Well, there are serious issues to be resolved. This senator is optimistic, and I believe that we are going to be able to achieve this goal of expanding affordable health care to nearly all Americans. We must do so without raising taxes on the middle class or upending their coverage. And we must do so without lowering the quality of health care for any American, including our senior citizens. I am, by nature, Mr. President, an optimist. And in the midst of everything that's wrong about this health care bill, I remain an optimist. And the moment of truth is coming when we cast that vote, yea or nay. Mr. President, I yield the floor, and I suggest the absence of a quorum.